Well, I've been the chairman of a large union trust for more than 25 years, I don't even want to say. I want to explain to you how I came to be a strong supporter of single payer. And a lot of it has to do with the way these union trusts, otherwise known as Taft-Hartley trusts, are organized and what they do. And back, say, this was in the late 80s when our trust was in serious financial difficulty. We were looking for ways that we could change that, turn it around, make them economically viable. A lot of what I'm going to talk about, I believe what the speakers said this morning, that healthcare is a human right. But I have to deal with economics and the cost and increased costs and so forth. So I have a tendency to focus on that. But don't think that I don't believe that, healthcare is a human right and that's what we should be pushing for. I just know it's easier to get done when it's affordable. So back in those days, we were in serious condition, and our membership and our trust was what was called fully insured, meaning that we had contracts with travelers or we had contracts with whatever insurance companies provided benefits. And as we looked at the rising costs, and of course, the essence of a Taft-Hartley trust, it comes from the Taft-Hartley amendments, and back in 1947 and so forth, there was a part of that, and Taft-Hartley says that a union trust has to be jointly administered. It has to have an equal number of union trustees and employer trustees, and those are the people that make decisions for the trust. For example, they design the schedule of benefits. They contract with trust professionals. They do all of that work that puts a benefit in the members' families' hands. And so back then, when I was looking at this and we had some serious financial problems, we thought, well, how can we start to eliminate some of these profit centers? And the first thing that I looked at, because I felt, well, we had a vision plan. And we thought, well, vision plans aren't expensive. They're not a big cost driver in a health plan, but we looked at it and we said, we can tell what our maximum potential liability is because we know how many people that we have in our trust, how many bodies that we're covering, and we know nobody has more than 2 eyes. So we thought, this is something we can self-fund. So we decided, let's self-fund it, let's see how that works out. And it worked pretty good. So we thought, well, what can we do next? And we looked at our dental plan. We know how many bodies we have. We know the maximum number of teeth in everybody's mouth. We know what our maximum potential liability is going to be. So let's try to self-fund that. And we did, and it was successful. And we started building reserves, and we thought, let's tackle the big enchilada. Let's go after the medical plan. And so we were able to do that because we built up enough reserves to cover our potential liability. Now, what does that mean, self-fund? It means that money comes in our case, I bargain about 90, I'm responsible at least for bargaining about 90 labor agreements with different private sector employers. From the very big, like Kroger or Safeway, to very small, that could be 3, 4, 5 person units, group of truck drivers attached to the back of some warehouse someplace, for example. And so what happens is we bargain a rate in the labor agreement, and until recently it was just full MOB, full maintenance of benefits. That means that the employer pays everything, right? And all those employers then contribute into that trust fund. They contribute into that fund. They put their money in the pot. And what do? We simply pay claims out of that. So when I heard about single payer, I thought, wow, that's the concept that we use. Our little trust is really a model of a single payer system. As the chairman, I'm not paid. There's no profit there. The employers who wish to be paid always, they don't get paid either. Union trustees are not paid. And we try to eliminate those profit centers. But it's the concept of all the money going into one pot and we simply pay claims. Now, some union members think, well, if you ask them, what kind of health care do you have? They'll say, oh, I've got Blue Cross Blue Shield. And they think that that's the insurance company that covers it. Sometimes that's the case. But in other instances, all that's happening there is the union trust has rented the Blue Cross Blue Shield network. They pay a fee to rent the network, and perhaps they hire Blue Cross Blue Shield to pay claims, to administer and pay claims according to the coding that the doctors and the providers put on the various claims. So this is not rocket science, folks. This is not that difficult. And we are consistently, because we have knocked out these profit centers, we are consistently able to provide a high-quality benefit, and ours is a very high-quality benefit, I'm proud to say, at a cost that cannot be met by insurance companies. Now, 10, 15 years ago, I used to have employers constantly come to the table trying to negotiate out of the union plan, because if the employer wants to get out of the union, first thing they go after is what? They go after the benefits. They go after the health care, they go after the pension, and then they say, what do you need the union for? You know, that's kind of the MO. And we used to see that. No employer can match our benefits, our schedule of benefits, for the cost under our plan. They don't even attempt it anymore, for the most part. There's always a battle over health care costs. So what we do is we go in and we negotiate labor agreements with individual employers. We know what that schedule of benefits is, what the cost is. The trustees design the schedule of benefits. The trustees are in charge. They design the schedule of benefits. And ours doesn't change much. And we bargain that money to pay for it from the employers. That's sort of how it works. But many of these union trusts, members think they've got a particular insurance carrier, like Blue Cross in this state is a big one. But oftentimes, not always, but oftentimes, they're just renting a particular, or they're buying a particular service from them. But they're still paying claims from that fund. All the money goes into one pot. We pay claims according to the schedule of benefits that we've designed. So it's a model of single payer. And when I really began to realize what single payer was, I thought, we can do on a national level what we do in our little model by knocking out these various profit centers. I mean, you heard this morning, 75,000 people die because of lack of health care. 700,000 go bankrupt every year for medical problems where they can't pay bills. This is the legacy of the for-profit system. And if we really want a system where we don't increase costs, but we increase efficiency and we cover everybody, it's a single-payer system. There's no other way. And that's why we are such strong proponents of improved and expanded Medicare for All, HR 676, whatever you want to call it, but we want to take the profits out of the system. So, we do want to hear from you, and I want to at this time turn it over to Mark Dudzic. Like I said, he's the coordinator, the national coordinator for the labor campaign for single payer. Mark?
Thanks. Good morning, brothers and sisters. It's really wonderful to be here. Portland Jobs with Justice has been a core supporter of the labor campaign for single payer. I want to thank you all for your support. It's meant a lot to us, and Tom actually serves on our National Steering Committee, and Fernando also serves on our National Steering Committee from Western Oregon. So we got some good folks here in the room. And I don't think I have to talk to you too much about single payer, about the crisis in healthcare. You heard some really good information this morning from Dr. Margaret Flowers. The only thing I would add, and it's no news to anybody here in this room, is that, it creates a crisis also in collective bargaining. Most strikes and lockouts are over the cost of health care, and the public workers are finding out that there's a gigantic freight train heading their way with health care and pension written all over it. It's a major, this is the NAFTA moment, this is the PATCO moment for our labor movement is coming right now, and the attacks on public employees and the attempt to strip them of hard-fought, hard-won benefit rights, because they know that's the last bastion of real union strength nationally. And if they can do that, they can really break the union movement in new ways. You know, they broke us in the old ways, but now they're going to go after the public workers. So that's sort of the broad context. And, you know, obviously we don't need to talk about a solution. We're here, you know, to support a single-payer solution, to make healthcare a birthright for everybody in this nation, make it like Medicare, like every other industrial country that's achieved healthcare for all, everybody in, nobody out, for a lot of the reasons Tom talked about. You know, that nonprofit worker-run insurance program should be the model for national healthcare delivery. Only, you know, it should cover everybody from birth to death, not be employment-based. So, you know, I think it's important that we remind ourselves of why labor has a special role to play in this fight for health care for all. I think it's really, I really believe that this is the crucial force that's going to win health care for all is the labor movement. Number one, it's our historic mission. If we're about anything, it's about fighting for the core interests and defending the ability to live and to survive for working people in this society. And, you know, labor needs to, you know, articulate these kind of demands in order to survive and to grow as a viable movement that represents working people in this country. And there's no more fundamental fight right now than the fight for health care. Secondly, it's a practical necessity because we can no longer bargain health care benefits effectively. You know, and you can just draw the chart. You know, when health care costs increase 2, 3, 4, 5, 6 times quicker than wages increase, all you have to do is draw the chart of the line of, you know, workers' income and the line of health care, and there's a point where, you know, it's going to cost more than what you can bargain in wages for workers. You're already bargaining, you know, $18,000 a year is not unusual, 20 grand a year for health care coverage, right, Brother Leedham? You know, that's more than a minimum wage worker earns working full-time, 52 weeks, 40 hours a week. So, you know, we can't continue to bargain. There's just it's a reality. We got to remove it from the bargaining table. And then the third reason why labor has to move on this is labor can be a real game changer. If labor put the kind of on-the-ground grassroots presence and financial support into the fight for single-payer health care that they've put into other fights, including electing a lot of these bozo politicians who, you know, sell us out before they get off the damn plane in Washington, D.C., we could change the whole nature of the debate about health care reform in this country if we really mobilize in the way that labor can mobilize. You know, we're a lot weaker than when I joined the labor movement back in the 1970s, but we're still about the only real working class organization not controlled in one way or another by corporate power that could really mobilize people and have the resources, both human resources and political and financial resources to do it. So 2009, about 2 weeks before the inauguration, a number of union leaders and activists from around the country came together to form the labor campaign for single payer. You know, basically around those principles and understanding that we were entering into a period when it looked like health care reform was going to happen. There was you know, both the crisis and the possibility of change that was going on. And we felt that what was needed was an organization based exclusively in labor with a goal to move the issue upward and outward within the labor movement. Number one, move it up from where the support for single payer is strongest, which is at the local level where people are engaged in these fights every day and they really understand that we've got to get out of this corporate health care system because it's defeating us in so many ways. To move that up into the higher levels of the labor movement where there's just a lot more, those folks are a lot more confused. They have divided loyalties. You know, they think that they're they still have a seat at the table, and so when they get the call, you know, from whoever, you know, it doesn't take much. It's very confusing. And, you know, there's other priorities and whatever. So we want to move it up. We want to move it out to align the labor movement with our natural allies in the communities, the religious community, you know, all of the folks who we need to have together in order to win this fight. And we wanted to make sure that our voice, the voice of labor folks, was really heard in the in Washington, inside the Beltway, in these debates over health care reform and in the various state level debates. And in a lot of ways, we've achieved an extraordinary amount in the last 2.5 years. I mean, obviously, we didn't win single payer on a national level, but we did win for the first time a resolution at the 2009 AFL-CIO convention, which put the Federation on record as supporting, a Medicare for all solution to the health care crisis. We did that by a lot of grassroots organizing. 77 state and local labor bodies sent resolutions to the AFL-CIO convention. That was more than any issue in the history of the AFL-CIO. It was a real grassroots attempt. And the resolution passed unanimously, and I have to think, I don't know this for a fact, is the reason it passed unanimously is because it was scheduled for debate on the day that President Obama was speaking to the AFL-CIO convention. And they knew that there were a couple hundred delegates at least out there who were going to put up a hard floor fight if there was any attempt to modify that resolution or put it on the table or anything else. And we had publicly announced that we were going to have a press conference right after the Obama speech to the convention. So there was somehow the opposition kind of withered away and the resolution passed. So when we were able to insert ourselves into the debates in Washington, D.C. about health care and in a number of national unions. And the national unions that both symbolically support single payer and the few that actively support it with real resources and political power has grown in the last year and a half. We're a growing movement within the labor movement. But we did end up with a bill this past spring called PPACA, the Patient Protection Affordable Care Act, which didn't accomplish what we set out to accomplish. And there are some good things in this bill, and we have to realize that because the Republicans and the corporate health care is going to try to pick out all of those few good things over the next 2 years. It did expand Medicaid coverage to millions more people. It created a network, or it supported a network of community clinics. That's very important for the folks who are getting it. It created some regulation. As Dr. Flowers said this morning, I'm really skeptical whether the insurance industry will really allow itself to be regulated under these new rules, except in a very formalistic way. I think they're going to figure out very quickly how to use the loopholes. But it left the job undone. It's not universal. For us as unionists, it did not in any way take health care off the bargaining table. It's still there in almost the exact form that it had been, and it in fact creates some new challenges. A number of us have been looking at what employer groups are doing as they're studying these groups, and a number of employer groups, including big companies like General Electric, have been looking at the potential of dumping their employees into these new insurance exchanges and paying the penalty. There's a minimal penalty up to $2,000 per employee that employers have to pay if they don't provide the minimal levels of coverage under the PPACA bill. And there's a growing movement to figure out how to get to dump employees onto these new state exchanges, perhaps with some limited subsidies for coverage, and basically saying, here's $5 grand, go buy your own insurance from these state exchanges. They'll eat the $2,000 fine, and they're all, insurance will be off the table in a bad way. It'll be off the bargaining table because there won't be no bargaining over health insurance. So, we have to be aware of those things. But most importantly, PPACA is not sustainable. There's no way that, number one, it can cover everybody in the U.S., and number two, that we can afford to continue to pay for it. By keeping private insurance in the middle of the healthcare delivery system, there's no way this system's going to last. Some people think it might not even make it to 2018 when it's supposed to be fully implemented. We're not going to be able to pay for this. In addition, as you know, there is a court challenge based on some right-wing libertarian free market ideology about what the Commerce Clause of the Constitution does and does not do, which may very well prevail in the Supreme Court. It's not necessarily a good thing that this court challenge will prevail, because it'll probably, if it does, it'll send a signal that all kinds of social insurance programs and things that we fought for as workers for 150 years would also be under attack. But that could throw the whole thing into jeopardy. So we have to be, this fight is an ongoing fight, both because we didn't win what we needed, and what we did win is going to be in crisis before we know it. So we've got to continue to mobilize, continue to be where we are. And just a few ideas, and this is sort of what we've talked about in the labor campaign about where we got to go next in the labor movement, and then we'll kind of open it up to some give and take here. Number one, on the national level, we've got to keep pushing for national legislation. We've got to continue to support national legislation and to continue to mobilize around it. We've brought to that discussion two important issues that are important to labor. Number one, on the Taft-Hartley Trust issue, which is very important to a number of unions. And a number of unions historically have been reluctant to support single-payer systems because they feel that it will throw them out of the healthcare providing business that they do very well, and that's a core program of most unions. So we've got any legislation, and the current legislation doesn't do this. We're talking to Senator Sanders when he resubmits his Senate legislation. You've got to carve out a role for the continuation of those trusts in a single-payer system. And there's three things that we're thinking need to be done in that area. Number one, you've got to allow, like a Canadian model of welfare trust funds. The Canadian unions provide supplemental benefits that are not covered under the national health care system. They provide additional benefits, and that should be explicitly recognized in any national legislation, that will and should continue, and that, you know, they support the role of creating these funds to provide supplemental benefits. This could be a huge, if union funds could get out of the business of this incredibly expensive basic medical coverage, it could be a very, an explosion of new benefits for workers. You could think about things like child care support and elder care support and legal benefits and all of these other benefits that welfare funds are constrained to provide because they just don't have they can't negotiate the dollars from their employers. So that's number one. Number two, there's got to be a requirement that employers negotiate with unions about the impact of national health care on their the total cost of their contracts. So an employer can't just say, okay, Teamsters Health and Welfare Fund, now that the government has a single payer system here, I guess we don't owe you $8 an hour or whatever it is that they pay in coverage. They've got to sit down and bargain over that impact. If they're paying $2 an hour in effective taxes, new taxes under single payer, that other $6 an hour becomes part of a bargaining process and needs to be reallocated. And thirdly, you got to keep alive the tax-free basis of contributions to union health and welfare programs in any single payer system to allow that to continue to bargain. So those are some of our challenges nationally. State programs, we got to be there. That's where the action is right now. We need to understand that there are significant roadblocks to establishing single payer on a state level. From a union perspective, again, unions that have multi-state welfare funds becomes very difficult for them to think about how they can carve out their workers in one state on a state plan and still maintain a multi-state fund. Financing is a real challenge on a state level. You don't have access to the same kind of flows of money that you have on a national level, which could create inherent crises in a state plan. You could end up in 2 years having bankrupted whatever, and that becomes a real challenge. So you need to really think about that. And then, the underestimating the opposition. I think it's very important to think about. If you're going to pursue a state plan, you can start out as a symbolic position, but you need to really think about how you're going to win it in an effective way, because the insurance industry and the for-profit medical industry just spent something like $500 billion to defeat comprehensive health care reform nationally. They're not going to allow the citizens of Oregon to institute something that they just quashed nationally unless they lose in a big fight. So those are some of the concerns on the state thing. Thirdly, we got to think about solidarity. When workers are in struggle over health care, we have to be there. We have to connect the solidarity that we owe to every worker who's in a fight with their boss with this broader fight for health care. And fourthly, connect it to a broader fight to defend and expand what we call the social insurance model, a whole fight that labor has led over hundreds of years to create a basic level of security for working people in this society. And we're talking Social Security, Medicare, Medicaid, workers' compensation, all of these programs that, stand between us and desperate poverty and homelessness. Those are the programs that we need to defend and expand. They're under attack today. We gotta counterattack. It's not enough to just defend them, because when you defend them, and I've been in the labor movement for 30-odd years doing this, you're moving backwards. You're throwing little pieces off and hoping you can slow them down. And we need to take the attack on that. And finally, it's our job to get the labor movement to make these things happen. It's a job of local union activists, local union leaders, to make sure that their movement, their union, their organizations are in the forefront. And we can only do that ourselves from inside the movement. We've got to organize our members. We've got to move it up from the local union through the councils and various bodies and up to the convention. And then we got to make sure that they put real teeth in what they're doing. There are some unions. Who's a member of AFSCME here? Okay, AFSCME, as far as I know, every convention in the past 25 years, national conventions of AFSCME, they've endorsed a single-payer solution to the healthcare crisis. You know what the national lobbying folks for AFSCME tell us in Washington, D.C.? We're done with health care. We did what we're going to do. We're done. We're not doing anything else on health care. We don't want to do it. So, there are unions that deliberately and consciously just ignore the mandate of their members in convention or whatever internal structures. There are unions that give lip service to their mandate. They'll say, oh yeah, we're for single payer, but we're not really going to do it. We're going to do this, 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 and this. And there are, thank goodness, a growing number of national unions that are actually beginning to put some real resources and muscle into the fight. And we now have probably 9 or 10 people on the executive council of the AFL-CIO who would probably stand up. We got a winter meeting coming up at the AFL. We're going to try to get them to put some teeth into the resolution we passed in 2009 and some resources, and we're going to move it from there. But for that, we need your help. We need your support to work both with the labor campaign for single payer nationally and with the groups here in Oregon State.